Let's face it, no one likes complications, especially when it comes to medical or dental procedures. Now, while there are certain risks associated with every type of procedure, the majority of the complications can often be prevented by having proper diagnostics and a plan that is well executed by the treating doctors. Certainly, dental implant therapy is no exception. Is it successful? Absolutely yes, but problems can and do occur. So whether you have had complications with your dental implants or are looking to have dental implants and are concerned about its success and its potential problems, I'm going to share with you what we know about dental implant complications, what causes it, how we can prevent it, and how it can be managed. I'm also going to talk about the human and the emotional side of patients as they go through such complications, and why it must be absolutely well understood before any revision treatments. I'm Dr. Ryan Kazemi, and welcome to Hints and Tips in Dentistry. In 1996, when I first began placing dental implants, little was known about its complications. At the time, there were some reports in the literature about their success rates, ranging about 80 to 85%. Still, those studies did not expand on the causes of implant complications, and certainly very little about their management. So around 2005, we began documenting patients that were referred to our office for various dental implant complications. We then shared several case reports and what we were seeing in those patients with our colleagues and the general public. I published several blogs and videos sharing my observations and experiences related to implant complications, which led to numerous inquiries from patients around the world who were experiencing such problems. That is when I realized that implant complications may be a much larger issue than we had known. Now, at that time, we had very little understanding of what causes it, and certainly any prevention strategies. We also had no protocols on how to manage them. In our practice, dental implant placement is one of the most common procedures that we perform. However, managing dental implant complications gradually became a subspecialty and a sub-interest, and a significant part of our work. So today, I will share with you what we have learned about implant complications, their contributing factors, what we can do to minimize them, patient experiences, and also the current treatment options. The unfortunate fact is that dental implant complications are on the rise, and this is in lieu of improved implant designs, materials, surface characteristics, and all the technology that have led to improved bone integration and healing. So what is causing this increase in implant complications, even with better materials and the technology that we have available? 2015, I published an ebook called The Painful Dental Implant, where I shared my observations on peri-implantitis, which is an inflammatory condition around dental implants, and what is now considered to be the #1 most common complication in implant dentistry. We reported that over 90% of the cases that were diagnosed with peri-implantitis, the reason behind it was poor planning and execution by the treating dentists. Yes, in 9 out of 10 cases, the problems originated not from the implants themselves, but related to the way the treatments were done. The remaining 10% were primarily patient-related risk factors, such as smoking, gum disease, and poor home care. And there was a small segment of cases with idiopathic or unknown causes. Our experiences since that publication continue to parallel the same findings currently. The majority of the complications are still caused by poor planning, poor execution, and lack of understanding of basic biology by the treating doctors. Hence, the primary reason for the general rise in the implant complications appears to be inexperience and lack of adequate training. In the early years of implant dentistry, only the surgical specialists, oral surgeons and periodontists, received the training to place dental implants. However, in the past 2 decades, there has been a significant increase in the general practitioners engaging in complex surgical procedures following a rather brief educational exposures during weekend courses or limited immersion programs. Increased income for general dentists and certainly a financial interest for dental implant companies have fueled the interest among general practitioners or prosthodontists to place dental implants on their own patients, rather than referral to a surgical specialist. Unsurprisingly, such dentists may be operating outside of their core competence. There are such enormous amounts of knowledge and skills that are necessary for restorative dentistry and implant surgery that is very difficult, if not impossible, to master both sides. Restorative dentistry and surgery are entirely different disciplines, and it takes years to become a subject matter expert in either. Now, just to be clear, I'm a strong proponent of personal advancement and climbing the educational ladder to learn and perform procedures beyond one's core competence. It is how we all learn and grow. So I do support any general practitioner who wants to learn and perform implant surgery, and of course related procedures. Following the 10,000-hour rule, the road to mastery in implant surgery is open for any general practitioner. And like many other educators, I believe that restorative dentists can perform implant surgery well, but only when they possess specialty level knowledge base and skills. However, it's important to note that complications are also seen among surgical specialists who have received the necessary and adequate training for performing surgical procedures. So why is that? After analysis of many patients with implant complications treated by specialists, one single factor came up time after time. In the majority of these patients, the implants were placed free-handed without digital diagnostics and surgical guides. Such practices often lead to poorly aligned implants, injuries to vital structures, and poor bone and gum tissue support, all of which result in poor aesthetics, poor function, infection, and ultimate failure. Most dental implant complications are due to poor implant position, inadequate bone and gum tissue, and inflammation from poor hygiene, which are entirely preventable. We now know that successful implant therapy is a multifactorial process. Suppose we could control everything that we can and plan and execute the treatments meticulously. In that case, we can expect predictable outcomes with long-term success. Remember that over 90% of the observed complications resulted from poor planning and execution. The literature and the experience support optimal treatment outcomes and low incidences of complications when dental implants are placed precisely aligned with the intended restoration in a well-supported and good quality bone with sufficient thickness and quality of the surrounding gum tissue. Aesthetic and functional results are further improved when restorations are designed and fabricated with compatibility to surrounding biology and anatomy. Implant longevity is achieved with proper home and professional care at regular intervals. Regular dental care and excellent oral health also help to maintain healthy implants. Patients can further improve long-term prognosis by avoiding smoking, maintaining a good home care, and also maintenance of good nutrition and general good physical and mental health. Digital technology has brought a paradigm shift in how we plan and execute treatments. Cone beam CT scan imaging gives us a precise assessment of the bone quality, quantity, and also the proximity of the adjacent vital structures. Digital impressions produce an accurate replication of patients' existing and missing teeth, as well as their bite relationship. Softwares allow us to merge the bone imaging with the patient's teeth to create a virtual restoration and place virtual dental implants in a three-dimensional perspective aligned with the intended restoration. This adds precision and safety to the entire treatment. 3D printers help us fabricate precise surgical guides according to the final implant position in the softwares. The surgical guides help us place the implants in the exact position predicted in the software itself. And digital diagnostics and workups also allow us to diagnose ridges with inadequate bone height or bone width and guide us in bone augmentation techniques to achieve the quality and the quantity of bone that is vital to implant success. They also help us formulate a plan for soft tissue augmentation, which is equally as critical for long-term health, maintenance around the implants, and the ultimate aesthetic results. Digitally based treatments are more predictable and achieve better results for our patients. The benefits of digital workflow are well recognized in our field. So patients need to understand this and demand it from their treating dentists. In my opinion, and many experts worldwide, dental implants should always be placed with digital diagnostics and total guidance. The alternative is too risky and with a dramatic increase in general complications. So now, what can we do for patients with dental implant complications? What are the best treatments when problems occur? Treatment of hundreds of patients with implant complications over the last 15 years has provided us an opportunity to create new protocols that did not exist before. It's important to realize that managing complications through revision therapies differs quite a bit from the initial implant placement. Complications often result in bone and gum tissue loss and compromise surrounding tissue biology. Patients' confidence is understandably less than when they started the treatment. And if not angry, most are at least hugely disappointed. And of course, they have already spent lots of money and their investment is now either at risk of partial or complete loss. So we had to create a different protocol for managing dental implant complications. Revision therapies with altered physical and emotional circumstances are more challenging. Hence, the first step in revision therapy is to investigate thoroughly and understand all the factors and events that may have led to the complications to begin with. The doctors must show patience and understand patients' feelings, emotions, and goals. Dentists must complete a comprehensive evaluation and all the diagnostic imaging to comprehend the status of the implants in question, and of course the health of the adjacent teeth and the condition of the surrounding bone and gum tissue. Clinicians must review all available diagnostics and records of the previous treatments in order to identify the potential causes of the complication. This way, the recommended revision therapies can be done more predictably by keeping those causes in mind. Often patients with implant complications seek care with a new team of dentists. And it is vitally important that the new team gets as much information from the patient and the previous dentist as much as possible to formulate a proper diagnosis and plan. Patients often start treatments with good hopes, positive energy, and high confidence. However, complications often lead to patients to the opposite state, with diminished trust. Understandably so, patients may respond with hesitation to any new treatment solutions that are offered. Regaining confidence and trust will take time. At the same time, clinicians must be open and honest with the prognosis and give a realistic picture of what to expect. While this may be a difficult conversation for a patient who is already stressed, it's essential to be open and disclose all facts. Honesty and openness in dialogue begins a slow journey for the patient to rebuild their confidence and give another chance at hopefully a successful outcome. The financial aspect of revision therapy is yet another important matter to think about. If performed by the same team of dentists, management of early complications is often rendered at no additional cost. Management of late complications might be subject to additional cost per circumventing factors and, of course, the dentist's policies. The picture, however, changes when patients seek revision care from their complications from another group of dentists. It is not unusual for patients to see a surgical specialist and a separate restorative dentist to manage their problems. In such cases, the new team will present a new treatment plan and fees for the revision therapy. So now, patients must face significant additional costs, which can be difficult to manage considering the money they have already spent for the initial treatment. Most patients wonder if the original dentist might reimburse their money and perhaps put it toward the new revision therapy. Patients should talk frankly with the initial dentist and convey their feelings in such circumstances. Patients may request a partial or a complete refund, and it is certainly up to the dentist to agree or not. An open conversation with an amicable solution is always the best approach. Most dentists ultimately want to see their patients happy, so they will make concessions on paid fees to avoid furthering their patients' anger and certainly preventing and avoiding potential legal actions. Management of implant complications requires a slow and methodical approach. An altered biology of the tissues surrounding the ailing or the failing implant calls for a staged treatment with more time and attention to details. Treatments often include the removal of the dental implants, followed by bone and soft tissue augmentation in a staged fashion. The new dental implant placement must follow a digital workflow guided by the restoration design and surgical guides. Surgical expertise is crucial in selection of appropriate techniques and materials. The restorative treatments must be carried out precisely to assure proper aesthetics and function as well as balance. And a close collaborative effort between a surgeon and the restorative dentist is essential. They must communicate continually and reassure the patient throughout the treatment. Dental implant therapy is highly predictable and successful when provided by a team of dentists following proper diagnostics, planning, and execution. Digital planning, proper bone augmentation techniques when necessary, and guided implant placement aligned with the intended restoration are critical factors in preventing common complications. And maintenance and adequate care assure stability, good health, and longevity of the treatments. Breaking these basic rules will ensure problems and complications, which are often more challenging to manage than the initial treatment. In such cases, following the protocols that we discussed in this video is absolutely essential. With careful and methodical diagnosis and planning, revision therapies can be successful in helping patients achieve their goals. Every patient we have talked to who has been through complications wished that they had asked more questions before their treatments and not blindly accept treatments or trust a dentist. We could not agree more. Such treatments require significant investment of time and money, and it is crucial that patients do their own due diligence and ask all the right questions before engaging in such treatments. So please make sure to download the critical questions before engaging in implant treatments that will help you be more engaged in your treatment decisions and outcome. We also welcome you to contact us with questions either in person or online. I'm Dr. Ryan Kazemi, and see you again soon on the next Hints and Tips in Dentistry.